Welcome to a new episode of Hear the Web. I'm your host, Tom, and here with me is my co-host, Lily.
Thanks, Tom. Today we are talking about an alarming public health situation unfolding in Mississippi. From 2016 to 2022, the number of babies born with syphilis has risen by a staggering 1,000%.
1,000%, Lily? That's a massive increase, to be precise, an escalation from 10 cases to 110. This data comes from the John D. Bower School of Population Health at the University of Mississippi Medical Center.
These researchers analyzed discharge data from both the Mississippi State Department of Health and the Mississippi Hospital Association. During the study period, they found an astonishing 367 infants hospitalized due to a diagnosis of congenital syphilis.
While hearing numerical data is very informative, let's put it into perspective to illustrate the gravity of the situation. Imagine being one of these parents. Just as you're preparing to welcome a healthy baby into the world, you're hit with the devastating news. Your infant might be infected with congenital syphilis.
Indeed, it's not just the mirage of shattered dreams, but also the long-term implications are distressing. Untreated syphilis can lead to severe defects in infants, including low blood count, jaundice, skin rashes, deformed bones, blindness, deafness, or even meningitis.
Yes, and nationwide, the rate has jumped 30.5% from 59.7 per 100,000 live births in 2020 to 77.9 in 2021. Shockingly, over 2,000 cases of congenital syphilis were reported in 2021 alone, the highest number reported in a year since 1994.
I think it's time we address the elephant in the room, Tom. There's an alarming racial discrepancy here. Of all infants with this disease, a staggering 71.1% were African American compared to 25.1% who were white.
Absolutely, Lily. It's evident that systemic problems contribute to these health disparities. It's also worth noting that risk factors for congenital syphilis were noted as Medicaid coverage, being older than 3 days and having mothers involved in illicit drug use.
That's a poignant point, Tom. Such differential access to healthcare certainly needs to be addressed. Further, infants with this condition were found more likely to be of low birth weight and be premature. Regrettably, the average length of hospital stay was 14.5 days, with average charges amounting to $56,802.
It begs the question, doesn't it? How did we get here? And more importantly, how do we resolve this? Experts are calling for comprehensive public health policies, increased access to prenatal care, and early diagnosis and treatment of syphilis during pregnancy.
To wrap it up, the situation in Mississippi is troubling, to say the least. It is a stark reminder of the larger public health issues looming overhead. We must commit to raising awareness, advocating preventive measures, and ensuring access to essential prenatal care.
Very well put, Lily. It's a grim reality, and we need to act now. Only by addressing both symptoms and systemic problems can we hope to reverse this alarming trend. Thanks for joining us on this episode of Hear the Web. Stay tuned for more about what's important on the web.